going to take your temperature to make sure you're doing good. I'll also check your collarbone here. Just stick your tongue a little bit out. But the skin should be back in the same color. Let's see on this one as well. I'm going to check on this one. Hi Patricia.
Hello.
So I understand you're here for your cardiovascular exam?
Yes, I am.
Okay, so today's date is December 2nd, right?
Yes.
So thank you for being here. Would you mind if I ask you some questions before we start the exam?
No, sure, it's okay.
Okay. So tell me if you have a history involving heart problems or blood vessels.
No, I don't.
No. Have you had any heart procedures?
No.
No?
Thankfully not.
Good. So now I want to ask you about some questions regarding your physical health. I know you're doing sports.
Yes.
You had a break right in the summer from
Yes.
what I remember, but you're doing sports again, right?
Yeah.
So how many times per day, how many times per week and how many hours?
4 times, 1.5 hours.
So 4 times, 1.5 hours.
Yes.
And are you doing any other exercising beside this?
Just walking, I guess.
Okay. Did you have any shortness of breath?
No.
Chest pain?
No.
Any light headiness?
No.
No. Did you had sensations of an fast heartbeat or irregular heartbeat?
Sometimes when I feel too much effort, when I do so much sports.
So you feel that sometimes?
Yeah. Maybe in a game, in a competition.
Okay. What about any swelling in your legs?
No.
No. Good. So looks like overall you are pretty healthy. So I will start the exam now and I will be checking your pulse, your chest. I will listen with the stethoscope. I will also check to make sure you don't have any edema. I will check your hands, your palms to make sure everything is fine, okay? Good. Do you have any questions, Patricia?
No.
Okay. So then we'll start the exam. Okay, Patricia, did you have any fever symptoms in the past days?
No.
No? So I'm going to take your temperature to make sure you're doing good. So it's 36.8 and that's fine. And I also want to take your blood pressure. Is this arm okay?
Yeah, sure.
Can I roll your sleeve a little bit?
Yes.
Okay. Okay. So you can relax like this. Okay. We'll put the stethoscope here and I'm gonna inflate now. Good. So blood pressure is normal, 120/81. Good. So I'm gonna come closer to you and I'm going to inspect your chest. It is okay if I just palpate
Sure.
and tell me if you feel any pain or tenderness, and I will stop, okay?
Okay.
So I'm going to put some gloves on. Did you have this exam before?
No.
No?
Never.
So I think it's really interesting.
Exciting.
Good, so let's see. Everything looks good. It's soft, your skin color, it's even. And I don't see any obvious masses so far. Okay. Good. I'm going to also check your collarbone here. Okay, everything seems normal and symmetric. Good. So just can you turn your head a little bit that way? I just going to check your neck and your veins here. Okay, good. Then you can turn your head if you want a little bit this way. Any pain?
No.
Okay, you can stay back in position. I also want to check your eyes for an anemia or if you have any jaundice. So I will come closer and I will check inside your eye. Is that okay?
Okay.
Okay. Perfect. Good. And I'm gonna lift a little bit. Great. Good. And can you also please open your mouth and say just stick your tongue a little bit out. Perfect. Color, it's pink, moist. I don't see any infection so far. You can relax now, Patricia. I just wanna make sure to check your face. Everything is symmetric and the color, it's pink, it's skin, it's okay. So I'm going to listen now and then I will ask you to lay down, okay? Okay, great. bit. Great. So now can you please lift your breast so I can listen here around?
Yes, sure.
Thank you. That's great. Okay, and just wait a little bit so I will listen with the bell. One more time. Okay, you can relax. And I just want to listen here. Okay, Patricia. So far, like I said, I didn't hear any murmurs. Normal rhythm of the heart. I heard just S1 and S2. And now I would like you to lay down and I will continue to listen also to your belly a little bit. I will check your back and I will also check your feet for edema.
Okay, sure.
I want to check your skin turgor if that's okay. So it's like a pinching test, but the skin should be back in the same color. Okay, great. So now I want also to check your arms a little bit and your palms. Can you give me also the other one?
Yes.
I want to make sure you don't have anemia or something else. Okay. And let me check the other side. So going to check your nails. Let's see. Capillary refill, it's within 2 seconds. Let's see on this one as well. Yes, it's within 2 seconds and the color looks great. Okay, so let me check your pulse now. Okay, perfect. So is it okay if you lift your shirt just a little bit so I can
Sure.
listen to your belly as well? I'm just going to check your skin a little bit. Skin looks normal. I'm gonna do the same pinching test. Smells, the candle smells so good.
Yes, it's amazing.
Okay, great. So far so good. I'm going to listen with the stethoscope and then I'm going to palpate.
Okay.
Okay. Great. So I'm going to palpate. Let me know if you have any pain or tenderness. Any pain here? It looks a little bit tender.
No.
No? Okay. Good. So I also want to percuss. On your left side here, I want to make sure I'm not missing anything. So is it okay if I just lift the
Yes.
shirt? Okay, can you take a deep breath in now? Exhale. One more time. Okay. Now, can you take a deep breath in? Exhale. Perfect. Okay, hold on a second. Can you take a deep breath in? Great. One more time. Take a deep breath in and exhale. I would like to listen to your carotid pulse now. So you can turn your head this way.
Okay.
going to listen in 3 different positions. Great, you can turn your head that way, please. And stay like this in position. Okay, you can turn, please. Okay, and now I'm gonna listen to your heart one more time. Okay, now can you bend forward a little bit? Okay, let me switch. Okay, so you're doing very good. I just want to check your back, okay? So if you can just turn around a little bit.
Sure.
Do you have any pain?
No.
No? Just want to check your lower back as well. This side it's a little bit colder than this one. Okay. Please take a deep breath in. in and exhale. One more time, please. Okay. So also your skin looks good. Everything is symmetric. So now if you can lay down so I can check your feet for any fluid retention.
Sure.
So is it okay if I just remove the socks?
Yes.
And to lift the...
Sure.
Okay. Good. So I like your nail polish.
Thank you.
Good. So I'm checking for edema to see if you have some indentation. No, you don't have edema. Let's see on this one. No, that's perfect. I'm going to check the temperature. It's the same on both feet. Let's see here, capillary refill. It's within 2 to 3 seconds. Let's check on this one as well. Okay, and let's see the pedal pulses. 3 plus. I'm going to check with the light to make sure everything is fine. I'm going to check on this one. Everything is symmetric. Color, it's pink. Skin, it's dry. I'm going to check your pulse. Da, oare unde ți se simte asta? Că aici ți-s venele, stai să vedem. Okay, great. I'm going to give you the socks also. Okay, Patricia, so I'm done with the exam. And just want to let you know about the findings.
Okay.
So, like I said before, you are very healthy. You have a regular rhythm. It's normal. I heard S1 and S2, no S3 or S4, no murmurs, no bruits, and no edema, and that's great. And Thank you so much for coming for this exam.
Thank
and
you for
if you
seeing
have
me.
any other problems, please call me anytime.
Thank you so much for seeing me today.
No problem. Do you have any questions regarding the exam?
No, if it's everything, everything is fine, I'm glad.
Yeah, so you can continue with the sport. So if you feel something, if it's uncomfortable, or if you have more, like you said, sometimes when you're tired or you have a competition regarding the heartbeat, you feel something is not right, just come back and I'm going to listen to your heart again.
Thank you so much.
Thank you so much for coming, and I will see you next time.
Thank you.
Bye-bye.